Hello, everyone. Welcome. We're so excited to have you all here. We'll give just a couple minutes for everybody to get signed in, but as we wait, I would like to introduce myself. My name is Madison Burnett, and I'm a BCBA, and I lead our professional development program. I'll be supporting throughout tonight's webinar. But before we begin, I'd like to tell you a little bit about Manhattan Psychology Group. So Karen, on the next slide, you will see that we were established in 2011, and we've continued to grow our team consisting of skilled adult and child psychologists, neuropsychologists, behavior analysts, special educators, licensed social workers, and ABA therapists. As a team, we are committed to wraparound care, which includes our wide range of services from mental health and testing to ABA and educational services. This holistic approach allows us to address various needs and challenges with compassion and care. We provide services to clients out of our Upper West Side and Long Island City offices, in home, school, and clinic-based settings, as well as through telehealth. Our team is committed to serving individuals, couples, and families of all ages in diverse settings. We are so pleased to offer these free monthly webinars for parents and professionals, where we will continue to learn and foster meaningful connections. Our vision at MPG is to create a future where individuals and their families feel supported, connected, and empowered. And our mission is to provide these multidisciplinary, integrative support for individuals and their families who experience mental health, behavioral, and educational challenges. All right, on the next slide, you will see some housekeeping information. This webinar is eligible for contact hours for New York State licensed psychologists and New York State licensed social workers. A link for the quiz regarding the content of the presentation will be posted in the chat within the last 5 to 10 minutes of the presentation. This webinar is free to watch and attend and engage with, but if you are looking for that CE certificate, there's a small nominal fee. That would be $10 for psychologists and $5 for social workers. But any polls that you see during, or any chats or anything that you see during the presentation aren't required, but they are encouraged. We'll be leaving the chat open, but please post any questions that you have in the Q&A so we can make sure that they are seen. If there is time at the end of the presentation, Karen will cover some of these questions. And now I'm excited to introduce our speaker. Karen, on the next slide. Perfect. Dr. Karen Surowick is a New York State and New Jersey licensed psychologist and a certified grief counselor. She earned her doctorate from Nathan Weiss Graduate College and joined MPG in 2021. She has helped develop a neuropsychological testing department. She provides compassionate, evidence-based care for individuals coping with grief, trauma, and loss. She also specializes in complex neuropsychological evaluations and has extensive experience working with children, family, and adults across medical, developmental, and forensic settings. She practices telepsychology under the Psych and is dedicated to providing inclusive, culturally sensitive support for all clients. And now, without further ado, I will hand it over to you, Karen.
Thank you so much, Madison. Hi, everybody. I'm Dr. Karen Surowick. So I'm going to be going over some of our goals for this evening, some of our learning objectives. So basically, I'm going to talk about, the different stages of child development and grief. I'm going to be talking about some emotional, behavioral, and physical signs of grief. I'm going to be talking about the different types of loss, and then how will a child express grief. I'll talk about some strategies and some language that we can use with children. I'm going to talk about some tools and activities, and those are kind of actually peppered throughout the presentation. I'm going to talk also about neurodivergent children and emotionally sensitive children. And then we'll talk about some adult support, and we'll talk about what to do when we want to get a little bit more help and how to recognize those signs. And then lastly, we're going to talk about how to respond to questions that children have regarding grief. All right, so let's get started. Before we move into our agenda, though, I added something a little bit extra. What I want to do is I just want to talk about in general, all of the theories of grief that are out there, which this is just a few. A lot of you might be really familiar with, especially like Kubler-Ross's 5 stages of grief. and possibly some of the other ones. There's a number of other theories out there. I don't want to get too scholarly about it, but these theories that have been buzzing around for many years often form a narrative for families. We hear little bits here and there. And the thing that I hear the most of people talk about, well, aren't there stages of grief? And that usually comes from this first one, the Kubler-Ross 5 stages of grief. So denial, anger, bargaining, depression, acceptance. So I bring these up because, like I said, it contributes to our narrative. If you're a clinician or if you're a parent or a caregiver, we all have some idea about like that grief has stages. But I'm here to tell you that there's really, really no exact formula for how grief occurs. I mean, basically, all these theories describe that there are emotional, behavioral, and adaptive responses to loss. And some of them will emphasize that the grief is dynamic, individualized, and that it evolves over time. The thing that I want to leave with everybody is that, grief is not linear. It varies greatly by age and developmental level. So, and if there are some stages that we notice that children are in, they may go back and forth, they may do things in a different order. That's all okay. So, all right, so that's my little spiel on the theories. The first thing we're going to talk about is the different developmental stages of grief in children. So, when we talk about ages like up to 5 years old, children have a limited understanding of permanence. So they may not totally grasp the idea that somebody is here, present on earth, and has died. They may not understand what death is. So it could be confusing for them. They'll have a limited understanding of what death and dying and loss is, but they'll know that something's different. So, as I mentioned before, there's going to be little things peppered throughout the presentation, and I won't always talk about them, but there's going to be a list of references at the end with all of these ideas. And I'll give you an example. So, sometimes when you're working with a child that's 5 years or younger, picture books are good, story-based types of things like play or puppets. Those are good things to use with children under 5. So then we get into the school age child. They start to begin to understand the finality of death. And at some point, they do realize that people don't live forever or that things don't last forever. And when a child is under 5, that's really hard to understand. That's why you will hear little children say, "You never let me do this," or "I always." So we hear never and always a lot with children under 5. But at 6 to 12, approximately, years old, we start to get an understanding of the permanence of things and that things don't really, they don't last forever. And they also begin to feel more adult-like feelings. Some children may start to feel guilt, anger, fear, so similar to what adults will feel. And then adolescents, 13 and older, they'll start to understand abstract concepts of loss. They may struggle with their own identity, where they fit within the losses. They may start to ask themselves existential questions or disconnect from peers. So you'll see a lot of different things going on for children who are adolescents and older. Okay. All right. So, one thing I do want to emphasize is that developmental age is not the same as age. So, what I mean by that is any child who is along a regular, like a typical developmental course, may have a somewhat similar understanding that goes according to those categories that we just talked about. But when we have children who are neurodivergent, they have certain diagnoses, sensory sensitivities, uh, autism, ADHD, any other sort of diagnoses, uh, or even physical challenges, cerebral palsy, any sort of like impairments or anything like that, their developmental level or developmental age might be different than their chronological age. So, I'll give you an example. A child who is 5 years old um, is, starting to read, starting to understand letter and number concepts, perhaps even coins and money and things like that. But if a child is learning delayed or developmentally delayed or has autism, they might be socially delayed or have difficulties with understanding certain concepts. So their developmental age is different than what their chronological age is. So we have to adjust for that. We have to remember that the chronological age is not always the same as where they are developmentally, as far as their cognitive abilities, their academic abilities, their social emotional skills, and whatnot. So, as far as symptoms that we'll see, or presentation more so that we'll see emotional expression. So, sadness, anxiety, guilt, anger, numbness, we'll see that. We'll see behavioral symptoms. Maybe there'll be a little bit of regression in smaller children, bedwetting, clinginess, difficulty separating from parents, maybe withdrawal from social activities, um, and perhaps some, academic challenges. And then sometimes we'll see physical symptoms. So things like sleep problems, appetite changes, body complaints. So I have a tummy ache, I have a headache, just complaints about things. So we'll see these. That grief manifest itself in a number of ways, and these are three of the primary ways. And so, children under 5, they often express grief not through words, but through their behavior. So if we go back to this, uh, they might not be able to express it emotionally, or at least label their emotions, but we'll see behavioral changes and we may even see some physical complaints. So for the younger ones, that's prominent for them. Okay, so understanding the different types of loss. Loss is not just the death of someone. As we know, there are a number of other things that can constitute loss, and that a child or even an adult or anybody could go through grief because of it. So there's changes in the family, parental separation, uh, individuals moving, being relocated. Maybe one parent is, has to take a job overseas for a period of time. So that's a disruption to the home, besides other things like, physically moving, foster care, immigration, things like that. If there's any sort of chronic illness in the family, with a loved one, a grandparent, a relative, anybody who's in your home or not in your home, if you have trips to the hospital, or, talk of like, medical things, this could also trigger a grief reaction. And then, so loss of routine, or like, quote unquote, like safety. So if we think about like the pandemic and how that really just kind of undermined everything that we knew at the time to be normal, and everything shifted. So our routines were different, our safety was in question. So major life events like that. And children will even react sometimes to world events, political things, or like natural disasters if they happen to catch wind of it, if it's a topic of discussion in school, especially like adolescents, they're once they're becoming like socially aware of the world around them and they start to form, their own ideas and opinions about things in the climate that we're in, then they may have some strong feelings about that, and that's pretty normal. So some other things that we can expect a possible grief reaction in, friends moving. I see a lot of little children, 5 and under. That's my specialty. With the loss of a friend moving far away. That hits home pretty hard for children because it takes a lot of time to form these friendships, and they're very important in the beginning. And so if a friend moves, it really can be a loss. It can be, very, very traumatic for them. Changing schools, just like moving, or even if they're in the same home, you're changing a school, switching up the education program or classrooms or things like that. That can cause a grief reaction. And yes, this last item here, left a favorite stuffed animal on the bus. It's okay. It's okay for a child to have a reaction that can be strong because they have this bond with a favorite toy or a favorite object. And that can be just as important to them as, a friend or, even sometimes, family interaction. So if a child has a reaction to something that's lost, it's good to treat it as a real thing, um, because they're going to feel a sense of safety in you acknowledging the loss and being able to, walk hand in hand with them through this, and then to find a solution if you get another one, whatever it might be. And that's a really nice thing to do. Um, for a child is to just kind of walk hand in hand with them if they do experience any sort of loss like that. Now, children who would have a very, very strong reaction to, say, like, a stuffed animal or an object or something like that, you might find that more so in children that have developmental delays or, cognitive challenges, or you'll even find that in children who have experienced traumatic events, separation, loss, foster care, things like that. So the fact that it's, they're getting upset over, say, like a stuffed animal or something could mean that there's just a history of something else going on for them as far as like events in the past, or even just like their own developmental trajectory is a little bit different. Okay. So creating a safe space for children who are grieving. It's really nice to be present, to be calm, to be available. Children will notice your tone. They'll notice your body language. They'll notice all your nonverbals. And so your facial expression. Sometimes I have to really like check my own facial expression. I happen to be very expressive facially. And sometimes kids notice my surprise or my excitement and even the sadness. Sometimes those things are really hard to hide. We're human, all, parents, adults, caregivers, educators, clinicians, and so it's good to just kind of reflect on what it is that you're feeling so that you know what you're expressing to the child. So when dealing with children who are grieving, again, we want to create that safe space. And so we really want to validate the emotions. Even if the child is not able to say exactly what they feel, they might not be able to say, I feel sad right now, or I feel angry. So, whatever it is that they express, you can say, tell me more. I love this idea of just this non-judgmental, curiosity of what it is that they're feeling. So you can encourage them through like storytelling, like we said before, playing with puppets, other sorts of expressions. You could have them do artistic things like drawings. So that can really help create a space for children if they're grieving. And then also having some predictable routines is and stability in their day is really reassuring. Most kids will thrive off of a routine and structure. And so having that a little bit more buttoned up for them can be really reassuring for them. And then the last thing with creating the space is that a child's going to move at their own pace. They may not want to talk one day, they may want to talk more another day, they may want to play or express themselves in different ways on different days. And they may or may not have a reaction to some things, and that's okay. Oh, one other thing I wanted to mention as like giving them choices for like ways to express themselves or things to do. Sometimes if a child is grieving, giving them more than one choice of activity could be overwhelming. So we want to maybe kind of give them a choice of two or make a suggestion, see if they like that. But sometimes too many choices could be overwhelming if they're grieving. So talking to children about death and loss, I like to use clear language. For me, I think that using words like died or passed away or literal terms like that sometimes can be very helpful. And I'll tell you why, because we use euphemisms such as like went to sleep or um, went to a different place or something like that. So I did have a patient one time where the child was afraid to go to sleep. And the reason for that was because a relative went to sleep and they didn't wake up. So, with a very small child, there can be some confusion about those types of things. I'm not saying to go against whatever like is culturally or um, against your faith or whatever it is that you think is appropriate. But keep in mind that there's could be some confusion if we use euphemisms or terms like going to sleep or things like that. So that's why I like to use just kind of literal terms that are age appropriate for the child. And follow their lead. If they have questions for you, it's good to answer them in the best way that you can. It's okay to not know everything. And it's also okay to just answer what they ask. And if they want to know more, then they can ask more. Sometimes us adults have a way of like over explaining things that kind of maybe could get a little bit confusing for children. So, the other thing is we don't have to have all the answers. It's okay to say, "You know what? I'm not sure about that. Let's look into that together." This way you're going again hand in hand with the child through this experience. You're working with them. They feel this sense of like togetherness with the adult and that they trust that even if you don't know the answers, you're willing to help them find the answers or at least explore something a little bit more. So, some tools for helping children during grief. Um, like I mentioned before, faith or religion, of course, if there are any belief systems, cultural systems, religious, anything like that that's near and dear to your heart or important to your family, then those are always nice to kind of resource as well. And you don't ever want to leave anything like that out. That's very important to your family. But you can also use other things like drawing, music, play, puppet shows. You can create your own new activities or rituals around the person or the thing that was lost. And so you can do things like planting a flower or like, having a little bit of like a ceremony or something like that. And encourage like talking about it, storytelling, memory sharing. And you can even introduce like calming strategies, especially if a child has been crying and a child who's been crying, sometimes they'll kind of like miss a beat with their breath. They have to like catch their breath. So one of the best calming techniques is to use breathing. And if we think about breathing, and breathing techniques, those could be kind of like daunting for a little child and honestly kind of boring for small children. Older children, they might be on board with it and see the benefits of it, but younger kids, we might have to use some other techniques. One of the things I like to do is this blowing out candles. So if you're playing and you do like pretend there's like some candles, you get a pinwheel, or even like smelling the flowers. So then that kind of forces the breathing in a good way to kind of regulate. And the more oxygen that they get into their body, the more calming it's going to be. So, just practicing blowing on that pinwheel, blowing bubbles, other things that are just, visually interesting and that can also regulate their breath. That would be nice too. So here's some examples of some things that you can use. There, again, there's a lot of resources at the end of this slideshow. A nice thing to use with smaller children or any age children really is the feelings chart. I'm sure you've all seen some version of this how are you feeling today? And it has a child with a facial expression, then it has the feeling underneath it. It's nice to have something like that handy if you're a clinician or a parent. So then you can access it and just kind of say, maybe you don't know what you're feeling just now, but let's figure it out together. Would you say that you're more scared or you're more sad or tired? And then you can go from there and explore what that might be like for them. So I mentioned before about neurodivergent children, emotionally sensitive children. So in talking about specifically children with certain diagnoses, it's really good to be sensitive to their specific needs. So, for example, if you have a child who's been diagnosed with autism, you want to watch for understanding on their face, whether or not they're, taking in the information, whether or not they're expressing the emotions. You might find that during a grieving period, a child who's been diagnosed with autism has more difficulty with social expression or social understanding. So their social preferences might change. It might just be more challenging for them. If you have a child who's been diagnosed with ADHD, that could they could be overwhelmed by stimuli. Their attention could be all over the place. So things to do would be like to reduce electronic use, distractions, maybe go places where there's less people, anything that's going to help them to focus a little bit better so they can feel calmer. And if you have a child with sensory sensitivities, you can always go into a quiet environment, dim the light, do things that are more soothing to them. So, grief could show up in a number of ways in children who have developmental diagnoses. That you could see increased rigidity, meltdown, shutting down. So in that case, especially for children maybe who are on the spectrum or have intellectual difficulties, you can use very concrete visuals and structured activities for emotional processing, like those charts. They're very handy. You can allow for nonverbal expression. So maybe there's some sensory toys, weighted blankets, other things that would be soothing to the child to help them feel better. And then, being mindful of the sensory triggers during, any sort of conversations or, like, rituals or proceedings or anything like that, especially if there's a loss and there's any kind of service or anything like that, it might be overwhelming sensory-wise for a child. Overall, you can pretty much prepare and maybe expect an increase in symptoms with whatever the child has been diagnosed with. So, if you talk about autism, ADHD, sensory processing, whatever their typical symptoms are, you may see an uptick in those symptoms. So, just keep an eye out for that. So, talking about adult support for kids. So, it's really good for adults to get an education about what grief might look like, this webinar being one of them. And, so then once we start to understand more so what grief might look like in a certain age child or certain developmental age child, then we can express ourselves in a way that they can understand. And we can also encourage their expression in a way that they're able to express themselves. So you want to get family members, educators, caregivers, therapists on the same page. So you can have things like family meetings. You can have like, you know, meetings with educators or just have a chat with like a therapist or anybody who is seeing your child on a regular basis, just to kind of debrief them on what has changed and what you're noticing and what to expect. So, especially for children in school, it's good for them to have like a person, a counselor, or even a favorite teacher, or a para, or somebody like that that they can go to, somebody that they know that they can talk to. And that's good to set up before they go back to school in case there's any sort of like break in school or anything like that. And, so you can tell them, well, if you have big feelings, you can go see so and so and you can take a little bit of time if you need to. So, how do we recognize when a child needs more help? We'll see persistent changes in the mood, behavior, sleep, or appetite, um, physical complaints with no real medical causes, stomach aches, headaches, boo boos, things like that. Um, Social withdrawal, we'll see, and we'll also see them maybe less interested in things that were previously really interesting to them. And so when we think about the time period, like if the symptoms persist longer than how many months? That's a really good question. How many months can we expect of these increased symptoms or different behavior or ailments or difficulties? About 2 months. So kids are pretty resilient. They start to bounce back from things incrementally, over time, slowly, but they get there eventually. If your child or a child that you're working with has had persistent difficulties for 2 months straight, I would say that that's, a little bit unusual. It is not unusual for a child to have as intense emotions 2 to 3, 4 months after an event, but if it's the same frequency, if it's the same amount of times per week, say it's 4 or 5 times per week for 2 or more months, that that's a lot of feelings to be having in that time. Again, I don't wanna make it sound like there's something wrong with your child, but they may need it a little bit extra support if they're starting to express these types of symptoms for more than a couple of months. Of course, in older children, if you see any sort of hints or talking about hopelessness, severe loss of interest in like playing with friends, spending time with friends, doing activities they really like. If they talk about guilt, missing out on opportunities, and of course, self harm, those are all indicators that you really want to get some extra support for the child. And I always say to parents, you know your child best. If your gut tells you something is off, it's worth investigating. It's okay to consult somebody and at least just ask, hey, is this typical? Do I need to get some extra support for my child? There's nothing wrong with that at all. So I'm going to talk a little bit more on a clinical level of grief in general. So the main diagnoses right now is this prolonged grief disorder. And so the Diagnostic and Statistical Manual defines this as a non pathological occurrence. So, meaning that grief is not pathological, meaning that it is not an illness to be grieving. And, even if it's prolonged grief, it's not an illness, but I think what we use these terms more so just to kind of give a red flag and say, this is something that this child is experiencing that needs more support. So it is tied to supporting children for and adults also for the experience of grief. And so again, like I said before, this is an intense, persistent symptoms, a set of symptoms. So it could be something like a preoccupation with the person who's passed away, preoccupation with the event. Say you moved. I did have a family one time that moved, and the child needed a lot of support in moving. They were really, really attached to the home. And so the family took pictures and they really kind of supported the child through this. And from the outside, some people might say, "How could this small child be so attached to this home?" But we don't know why. We don't know, you know, it's meaningful for the child, so we have to honor that. And so they could be preoccupied with something, as this one family learned that the child was just really preoccupied with things in the home and things about the home. And it was very important for them to get that support, getting pictures and drawing pictures and taking memories from their old home into the new home. So if we see that for a prolonged period of time, 4, 5, 6 months after the move, after the loss of somebody, if we see that intensity, the same that it was in the first month, then that tells us something. So also we look for significant distress or impairment. Is it interrupting the daily routine? Is the child unable to go to school 4 or 5 months after? Again, is it the same level intensity as it was in the beginning? So for adults, we say that if these feelings last for more than 12 months, and this is again like ballpark, or in children more than 6 months, then you know, it could be something that needs clinical attention. If the symptoms include emotional numbness, avoidance, shock, disbelief, questions about who am I, and especially in older kids, who am I and what happened here, and just really kind of this really just difficulty understanding the facts of things or avoidance of reminders of the loss and difficulty reintegrating into life after the loss, then it's a really good idea to get some clinical support for that. Because again, grieving is a normal thing. Intense grieving is a normal thing. Prolonged intense grieving needs a little bit extra support. So it's good to kind of, you know, say to yourself after several months, and if the intensity is the same, then it's good to get this checked out. So some other things that we also have to keep in mind with grief, um, grief could look like depression. So, if we think about the symptoms of depression, sleeping more, eating less, just being tired, a loss of interest in things, those are all symptoms of depression. So, those can also be symptoms of grief. Now, if these symptoms continue after this 12 or 6 month period, um, without intervention, or with intervention, if you have a therapist and you have somebody working with the child and these symptoms are still continuing, you might be looking at possible other diagnoses like the major depressive disorder or some other sort of mood difficulty, adjustment disorder. And then, if the child or the family, anybody has experienced traumatic events in the past, the reactions to grief can sometimes look like the post-traumatic stress reactions, nightmares, difficulty getting to sleep, staying asleep, avoiding reminders of the person or the place or the activity, uh, startle reaction. So, some of these other symptoms that are in these other diagnoses can sometimes be in this prolonged grief disorder. Doesn't mean that there's a specific diagnosis, but again, best to get them checked out by a professional if you're seeing any of those. Okay, so responding with confidence and compassion. Like I said before, you don't have to have all the answers. Your presence is really what matters. Your presence, your tone, your being there, you know, giving a hug, giving some comfort, playing a certain game or something that'll comfort the child. That's really important. Another thing that's easy to do is to want to fix things because we don't want children to feel horrible about things. So it's easy for us to want to fix it. So coming up with solutions, coming up with um, specific things can be really easy to do, but sometimes it's better to take the child's lead and what do you need or what do you want right now? So, just let them know that you're there with them and that, they have somebody supporting them. And it's really important to, don't give them directives as far as don't cry or do this or don't do that. So just being really open-minded about their whole process. And the other thing is it's okay for children to see our emotion. Some adults might think like, oh, it's not good for a child to see me cry. I never heard a child say, uh, that they were upset because they saw a parent cry. One thing that I do hear in therapy a lot is that I never saw so and so cry. So it's interesting. That seems to have made more of an impression with a lot of children I've worked with in the past, as far as like emotional expression. It was more so children noticed the lack of emotional expression versus the emotional expression themselves. But that's just the clients that I've had in the past and worked with. So anyway, so it is okay for you to express emotion because then what that does is it gives you an opportunity to model healthy emotion expression and regulation and letting a child know that it's healthy and normal to cry or to express themselves. It's totally normal to do that. And sometimes children will be overwhelmed with emotion and just sometimes have a crying fit. And they'll, that's where they get into, not really being able to regulate their breathing. So in those moments, it's okay to take a step and say, all right, let's take a deep breath. Let's go for a little walk. Let's shift gears a little bit. So they're not in distress for too long. Um, so other things that you can say, um, during these times is, I understand you might miss, if a friend had moved or they lost a pet, I understand you miss so and so. Tell me more about that. What is that feeling like for you? Or what are you thinking? And if they're too young to understand how to express their feelings, those feelings charts come in handy. And then finding a feeling on the chart and helping them navigate through that is really helpful. So it's okay to revisit conversations. You don't have to get everything out in one sitting. You can do check-ins and create a space down the line for more expression when the child feels they want to express it. And then also, we talked about this earlier, identifying safe adults. So if that be in the school setting, in the after school setting, weekend activities, whatever that is, making sure that they know that they have somebody that they can go to and talk to. Okay, so the rest of this is some resources, which everybody will get a copy of the PowerPoint. So I won't spend any time on that. And I'll hand it over back to Madison.
Yes, so as she just mentioned, I have just posted the slides for today's presentation in the chat. We will also be sending an email out to everyone following the presentation, so you can also access them there. We do have a few questions that came in. One of them was regarding how a parent should express some of their grief, if they should express it if they were sad too. I believe you've answered that. If this was your question and you want some further details or more clarification, if you could post whatever that would be great. All right. The next question is, have you worked with children who mourn staff who have left?
Absolutely, yes. I was just working with a child today whose teacher left. And I've had that before. So teacher, therapist, trusted adult. Children will form bonds with the people who are important to them. And so, yes, I have worked with children who are grieving that loss or separation. And, you can treat that just like it is, a regular grieving process. You can do activities with them to honor that person and that relationship that they had. If there's any other connection or rituals or activities or anything that you can do to honor that relationship, drawing pictures, activities that you used to do together, sharing memories. I think that's a great way to do it. Totally normal.
So this next question, I believe it came in around the third objective, but the question is, what is considered a strong reaction?
Okay, yeah. So a strong reaction. Um, so it's So when we talk about the intensity of something, um, a child usually can express their emotions in a way so that they can just kind of express them um, with an intensity that that kind of relieves that pressure for them. So crying, stomping, rolling, around on the couch or something like that. If it gets into something where they're like throwing things, pinching other people, biting, or even older kids like cursing, yelling, being disrespectful. So if you have something that's kind of not quite safe behavior for the child or for somebody else, then we're talking about something that's a little bit intense. And it depends on how long it goes on. Most people have had moments where they just really have to express very strong feelings, and they do very briefly. So if it's very intense and it happens for a prolonged period of time, that's when we're really concerned. And of course, when anybody's safety is involved.
Understood. All right, next, can a child that's 2 years old have a problem in the house with parents fighting, constant changes in the house and school, experience grieving?
Absolutely, yes. Yes. I love this question because um as I mentioned early in the beginning, my specialty is 5 and under. It used to be 3 and under. I expanded to 5 and under. So early development, early childhood is a very vulnerable time. A lot of people will think that a young child won't understand or won't um, react to arguing or separation or loss or something like that. Children as young as infants can react to their environment. They can tell tense voices. They can tell, body language. They can see it or feel it. The volume of voices and kids know. They do. They know on some level, and sometimes it's just on a visceral level. There's an experiment, I'll tell you about it briefly, where this still face experiment where the parent would smile at the child and this child would smile back. And then the parent would look at the child and not smile. And just that action of not smiling to the child made the child cry because the child was trying to smile, trying to get the parent to engage. And when the parent did not respond, that child cried. So that showed us that sensitivity is something that happens very early on. It's on an innate level, it's on a visceral level. It's there though. So yeah, they pick up on it.
How do you rule out headaches and stomach aches that are physical versus grief? Pediatricians are not always helpful with this.
Good question. Well, do they come at certain times? Is there a headache or a stomach ache when it's time to do something that they don't want to do? It's kind of like when a child says, I don't know, or I don't remember. I don't feel good goes in those comments as well. Is it when they're being asked to do something or it's time to do something that they don't want to do? So, is there always a headache or stomach ache when it's time to go to school? Is there a headache or stomach ache when it's time to get ready for bed and brush your teeth or put on your pajamas? So, look at the timing of it. What is it that they're avoiding? And if there's a consistent thing that they're avoiding, then it's probably just that they don't want to do something and they're feeling uncomfortable about it. And that seems like the best way for them to express it.
Mhm. All right. One of my clients experiences an increase in ADHD symptoms and meltdowns the week after we talk in session about loss of access to parents due to a custody loss. How should I navigate discussing this reaction with foster parents?
Mm, really good question. Really good question. Um, Good for foster parents to gain an understanding of child's emotional um, developmental age. So, depending on the child, educating them on where the child might be as far as that chart I first showed you, like the 0 to 5, the 6 to 12. So, educating the foster parent on that. Where are they age wise, development wise, and then take into consideration any diagnoses as well. So then, help them to understand where the child is at so that they can be the most supportive and the most compassionate with them um, based on this information, not just based on their age or what they think stage they should be in. So I hope that helps.
The last question that we have as of now is, do you have any suggestions for integrating children in an end of life celebration?
I like that question. That is a beautiful question. You know, the end of life is a very, very precious time for families if we are lucky enough to be able to plan for that. I'm assuming it's, we know that the person is going to pass. Um, so end of life care is so important, involving children in this whole process of the end of life and not only saying goodbyes, but even before that step, what are the things that you want to share? Say it's grandma or grandpa or Uncle Joe or whoever. What are the things you want to share with him? What do you think that he wants to share with you? Or, just involving them in that process is so natural. We celebrate birth, we celebrate we have so many celebrations for the beginning of life, but we don't have anything for the end of life, and the end of life is something to be honored as well. So involving children in having that be as peaceful and as emotionally natural process as possible. Again, use some of those techniques we talked about in the PowerPoint: drawings, play-based therapy, narrative, storytelling, spending time with the person. Just being part of it is such a beautiful experience for them.
We did have a couple more come in, so perfect. How can we help and support children in early childhood who to deal with the separation when changing teachers if they change classes or separating from parents at drop off? We have children that can cry for months nonstop. We do visual schedules and we encourage families to do slowly the transition, but still it is a big problem for some children.
Love these questions. Love it. So,
Great.
yeah. So I would separate these into two different things. So if we're talking about the change of a teacher, for example, that definitely falls into like the grief or the lost area because they have a bond with that person and that person's not going to be there it on the same basis in the future. Separating from a parent at drop off, that falls more into like an attachment type of thing. I wouldn't say that that's necessarily full-blown grief. If we go back to our theories and like Bowlby with the attachment, the secure attachment, the insecure attachment, talk about attachment theory, that's more of a brief, a transient thing, even though it seems like it's forever, lasting forever. The difficulty separating takes a very long time. I would see a professional about that for sure, because social anxiety, separation anxiety, having to do with those primary relationships when that parent is going to be there when they get home, if they're not coping with that in a way that's adaptable, that's letting them attend school on a regular basis, then I would say talk to a professional about that so that you can get the help and support that you need. Because there's so much more to say about that. So I
Oh my
would say talk to someone.
All right. Can someone as young as 2.5 years old carry the grief of an uncle who passed all the way through to 7, that is still very present? Do you have any ideas past the grief box and books about heaven and grief rituals?
That's very interesting. If we look at what we talked about in this presentation, from 2 to 7, that falls well outside of this realm of 6 months or even for an adult, 1 year of grief. I'm hesitant to say that it's officially prolonged grief, but I would want to get to the bottom of it. What is coming up for this child with this individual? Are there reminders about this person that are triggering certain things and reactions? Are there objects left behind? Are there activities? Are there other people who are bringing this up? Like I said before, like children are pretty resilient. They want the bodies and their minds want to heal and rebound from these things. So we really can expect less intensity and less frequency over time. If we're talking about 5 years, I would seek professional support for that. I'm wondering what's going on there as far as like reminders or activities. Maybe the uncle bequeathed his pet cat to the family and the child is reminded of the uncle every time he pets the cat. I don't know. I'd want to investigate this and get to the bottom of it.
Well, this does conclude the end of our presentation today. Thank you, Karen. It was fantastic, and I know that there was a lot of important information here. Thank you, everyone, for joining us today. As we've mentioned previously, we will be sending out an email following the presentation to all registrants with the link for the recording, as well as the link for the CE certificates and the slides. So if you do have any additional questions, feel free to email me professionaldevelopment@manhattanpsychologygroup.com. If you think of any additional questions or really have any feedback to share, feel free to send it our way. Thank you so much, everyone, for joining us, and I hope everyone has a great night.
Thank you, everyone.